50 to 100 million policy cancellations reportedly set to happen for both large and small businesses. That is well beyond the 5% the administration likes to cite.
But I don't think we're going to be able to eliminate employer coverage immediately.
As of today, more than 5 million Americans have received insurance cancellation notices, leaving them in limbo when it comes to their health care.
I was startled. I was shocked when our health insurance went up 49% this year. I want to provide health insurance for my employees and their families. We've been doing it for 15 years since I bought the company. But now, because it's so high, our plan, in effect, is not viable because it's not affordable.
But I don't think we're going to be able to eliminate employer coverage immediately.
There's be a surprise, especially for sort of smaller, younger, entrepreneurial firms who often have healthier employees than the mean, because they'll be faced with higher premiums on the new small business exchanges. Because as you know, like in the individual market, there'll be a lot of redistribution from sick to healthy, from old to young.
And some business groups are predicting that a large number of business decision makers are planning to drop health care coverage, instead opting for a fine for their employees. John?
But I don't think we're going to be able to eliminate employer coverage immediately.
Amy, Republicans are out there saying, "I told you so," that it's more than just the rollout of the website, which still has plenty of problems. But the devil here is in the details, and when you get in the details of what is required under the Obamacare law, a lot of people are not happy.
Absolutely. A lot of people are being thrown off their insurance, and when they try to sign up, if they can even get on the exchange website, they're finding that the insurance is more expensive and the deductibles are higher than they had before. So in many ways, it's the Unaffordable Care Act. There's actually a story out of Washington now, a lady who signed up originally on the Washington exchange, and it looked like she was going to get insurance for her and her family for under $200 a month. She wrote a letter to President Obama, and President Obama mentioned her in a speech as an example of what the Affordable Care Act can provide. It turns out that there was a glitch in the website. She's going to have to pay over $600 a month, not the under $200 that she thought, and she just can't afford it. So she's going to go without health insurance. So this is not turning out to be affordable for many Americans.
Well, and for instance, that business owner who was testifying before Congress in Mike Emanuel's report, your health care costs to insure your employees and their families go up 49% in 1 year. I mean, what kind of business can afford that kind of inflation?
Well, that actually puts the lie to the claim that the administration was initially peddling, that only 5% of people are going to be affected and may lose their health insurance because of Obamacare. The truth is that even in places like the small business market, where people are getting insurance through their employer, these health premiums are going to go up. So either they're going to have to pay more for their insurance, their employer is going to make them pay more, or they're going to have to downgrade their insurance and get a lesser program because their employer can't pay the increase in premium, or the employer is going to drop them altogether and they're going to be forced into the Obamacare exchange.
But I don't think we're going to be able to eliminate employer coverage immediately.
Let me repeat this. Nothing in our plan requires you to change what you have. If you like your insurance plan, you will keep it. If you like your current insurance, you will keep your current insurance. You'll be able to keep your health care plan, period.
No matter what you've heard, if you like your doctor or health care plan, you can keep it.
Fox News confirming that the administration knew, they knew back in 2010, that millions of Americans would lose their health care plans, even though the president had repeatedly promised the opposite was true. And you may remember, he didn't just say that repeatedly when they were debating the health care bill. He went there again after it became law as recently as 2012.
Let me tell you exactly what Obamacare did. Number one, if you've got health insurance, it doesn't mean a government takeover. You keep your own insurance. You keep your own doctor.
The support of the majority of the American people. The president promised repeatedly those plans would be grandfathered. You heard Ed say it. He said, if you've got a plan right now and Obamacare passes, you'll have a grandfathered plan. You will be able to keep that coverage and your doctor. Well, that's not true. The old grandfathering didn't work out at all because members of his administration saw to it.
The lie can be maintained only for such time as the state can shield the people from the political, economic, and/or military consequences of the lie. It thus becomes vitally important for the state to use all of its powers to repress dissent, for the truth is the mortal enemy of the lie, and thus, by extension, the truth is the greatest enemy of the state. Joseph Goebbels, Nazi Minister of Propaganda.
You'll be able to keep your health care plan. Period.
As of today, more than 5 million Americans have received insurance cancellation notices, leaving them in limbo when it comes to their health care.